This is a public service announcement regarding disparities in maternal mortality in Black mothers. Maternal mortality in the United States is higher than in any other developed country and is the only developed country with a maternal mortality rate that is on the rise. Between 2000 and 2014, the United States saw a 26% increase in the maternal mortality rate. This is a public health issue that affects us all. However, it hits the African American community harder than any other. Black mothers are 3.4 times more likely to die of a pregnancy-related cause than white women. These disparities in maternal mortality occur at the patient, provider, and systems level. The Black-white maternal mortality gap is widening. In 2007, 34% of women who died of pregnancy-related deaths were Black women, and in 2011, that number rose to 42.8%. All while the percentage of pregnancy-related deaths amongst white women stayed stable. As many as 50% of pregnancy-related deaths are preventable. Pregnancy-related deaths are most commonly caused by cardiovascular conditions, other medical conditions, pre-existing illness, infection, and hemorrhage. These disparities are the result of healthcare inequities, which are differences in healthcare access or quality. Racial disparities are present in all aspects of healthcare, including obstetrics. Disparities in maternal mortality are complex, as there are a multitude of influences, such as social determinants of health, which are economic and social conditions, quality of care, and institutionalized racism. Site of delivery has an impact on outcomes. Black women have a higher risk of mortality when they deliver in metropolitan or non-rural areas due to a lack of quality at hospitals serving majority families of color. However, even when Black women deliver at hospitals that serve predominantly white patients that have better scores on quality measures, they still have poor outcomes as compared with white women served at the same hospital. Rates of preeclampsia, placental abruption, and diabetes are higher among non-Hispanic African American women. Additionally, Black women are more likely to suffer from peripartum cardiovascular, cerebrovascular, renal, and pulmonary diseases, obstetric hemorrhages, and trauma. Black patients should receive care of equal quantity and quality as patients of other races, according to their individual needs and risk factors. There are multiple aspects of system failure, and these disparities have affected generations. At the provider level, the awareness and attitudes among healthcare workers can increase disparities. Lack of cultural competence or commitment to health parity are issues. Implicit racial bias is so powerful that it has been shown to impact care decisions by physicians. On the institutional level, there are many structural barriers that prevent patients from accessing the care they need. Low health literacy, insurance, transportation, inability to pay, lack of access to healthcare, and poor quality healthcare all contribute to health disparities. Prevention strategies for high-risk groups, such as aspirin therapy to reduce the risk of preeclampsia, should be standard practice. Clinical protocols for hypertension, diabetes, and obesity should include an algorithm for risk stratification and targeting treatment to those who are most vulnerable. There are many challenges to addressing disparities in maternal mortality. There needs to be multidisciplinary coordination and an increase in services in the disciplines of social work, mental health, nutrition, primary care providers, specialists, and community health. Access to primary care is protective for the prenatal period as well as for potential future pregnancies. Working at the community level with maternity care coordinators to reduce structural barriers such as lack of transportation is essential. A culture shift is also required but is a challenge to attain. Training for all medical staff on cultural competency and implicit and explicit bias should be the baseline to attempt to minimize the impact of racism on patient treatment. Racial disparities in maternal mortality are an urgent public health issue and must be prioritized. Black women are dying in pregnancy at 4 times the rate of white women, and this should be setting off alarm bells. Providers and healthcare workers need training and accountability to improve their care. It should be the task of all healthcare providers to make it their personal mission to contribute to the reduction of maternal mortality in Black mothers. These disparities did not develop overnight, and they will not disappear overnight, but with a multifaceted approach, change is possible, and that change will benefit us all.